So, while I'm busy working away, I will tell you a little bit about my practice and what my research is looking at. Before I do that, however, I want to start by giving you an update and putting this research into the present day context. Like we all may feel in various amounts, the world is a very different place at present. Things have changed drastically since I originally put my proposal in to present at this conference, and there have been times where I wasn't so sure I wanted to continue. My research was to be conducted with residents in care homes, and as you can imagine, this is not possible at the moment. I was hoping I would have a lot more data collected that I could share, and as you will see in this presentation, due to the nature of the research, it's about being tactile and about experiencing space together, and so I felt digital and remote methods are not really appropriate to pursue at the moment. The main reasons, however, are also that life in care homes are so changed. Care home staff do not have the means, time or resources other than to conduct their own duties at the moment, and any research would also take away valuable screen time away from loved ones too. Having said all of this, I do feel there is still a nub of relevance to the research, and I hope to restart when time allows. As some of us may have experienced over the last year, space is of primary importance to us all. Our environment is one of the core categories of determinants of health. We are spatial beings. We exist in space. It is one of the primary experience connections to one another. So to put the field of inquiry into perspective, I want to tell you a little bit about my practice and the work that led to this research project. I'm an artist, qualified counsellor, and I work as an emotional support worker for an arts organisation in Greater Manchester, and I've worked in this field for over 15 years. I use language, visual arts and other forms of communication to work with people on their well-being and creativity. I originally became interested in space and its effect on our creativity and sense of identity when providing creative activities in various care homes. Care homes are a unique setting in that the space has multiple functions for different people that live, work or visit them. The dining room table has to also be a studio or creative area, and for some individuals, perhaps with memory impairments, these blurred boundaries can be difficult to comprehend. I became interested in inserting a temporary space that had no pre-existing function or baggage and could allow a new form of relationship to form with the space. The temporary, carnivalesque, playful element of a novel and bespoke space could be a way to begin a new conversation and exploration. This is where the idea came from with a project I called the Travelling Art Tent. This was an Arts Council funded project where creative sessions were held for residents within 4 settings. We designed the space together and then I framed and responded to this work to create the space. The Travelling Art Tent then toured the 4 organisations as a form of exhibition space, multisensory environment and installation sculpture. The temporary gallery used the work created as a socio-optical space to bring people together to create, share and interact. The gallery exhibition events also had activities and sensory experiences for those visiting the exhibition. From this project, I wanted to explore these themes further in a research capacity. The research has 3 core components that sit alongside each other. There is a great deal of research around arts for well-being, art in or for health, around activities and the benefits of creating, viewing art in galleries, or working with someone such as a carer. Looking through this research, there are very few mentions on where the research sessions took place or how the workshops were set up. As I alluded to before, the care home has to be a home, a workplace, an institution and vehicle for legislative and regulatory provisions of care and healthcare. Their environment also comprises of the physical space, also the social and institutional setting. Within all of this, there can be little opportunity for the individual to assert their identity through the usual ways such as home decoration or moving furniture to how an individual may like. Identity does not have to be solely expressed through environment. There are various research articles on individuals expressing their identity through their clothes, how they make food, or even their handbags. However, space allows a holistic whole body and mind experience. Our need to express our identity remains throughout the life cycle, and for those in care homes, these opportunities may be limited. The research is interested in looking at the individual's experience. In order to attempt to shift power and gain understanding of the experiences of the individual, they must be included more widely within the field of research overall and involved in the process itself. And so this led me to the research project and the research title, Identity and Installations, using arts for wellbeing practice to explore identity through site-specific participatory installation art with older people in care home communal spaces. but in my practice I wasn't sure what elements to develop. So this research into this field and my practice led me to the concept of den making. Dens are temporary constructions often associated with childhood play. There is evidence of den-like structures in many cultures and geographical locations, created through found objects and environments or constructed a variety of processes and materials. These transitory environments can be a place of learning, play and creative agency in which private worlds can be processed and produced and where roles and rules can be tested. As Tovey writes, these den spaces allow for privacy, imagination and temporary ownership, and how individuals can feel a sense of agency in shaping and creating their own special place, making their mark on the world. Sobel comments on how these environments can hold special meanings and are a world with its own rules, that holds its own internal logic. His research found that these special places are safe, organised worlds that are owned by and empower their creators. Den making as a process comprises of these several components that incorporate the creation of a physical space, the rules of engagement, the roles generated through interaction, and potentially other objects that inform or reaffirm this internal logic. Coughlin refers to the relationships between the expression of the physical object, the activities devised, and the meaning-making generated through interaction with the physical space. And so these processes require creativity, imagination, social negotiation and context, as referred to in the process of social spatial mediation and articulation. And so, looking through this research on dens, forts, tree houses, Wendy houses, there is a real interesting and potentially useful set of qualities that could be used within the arts for wellbeing mode of working. Dens have the ability to explore and experiment with elements of identity within a play context. Concepts can be tested, discarded or retained depending on the outcome with a reduced sense of risk, both for the individual but also the care home or environment. And so this fits well in with the idea of installation art, particularly utilising Claire Bishop's and Mark Rosenthal's concepts around the form of installation art. Installation art is congruent towards and mirrors the ideas and ethos of arts well-being to some degree, as they are both interested in a holistic view of the process and experience for the individual. Following on from this concept, this research aims to focus on the alternative or respite spaces to explore individuals' concept of identity in the care home setting, as potential authoritatively unobserved spaces that reside outside of the familiar routine and communal space. Potential new ways of thinking towards identity may be discovered through novel spaces. While acknowledging the importance of the freedom in these spaces as they are, this project seeks to enhance the care home environment through temporarily disrupting and altering this static shared space. This form of den making practice has developed in creating spaces in different ways, such as exploring the space as a way to enhance or promote creative engagement, where the activity becomes the space, and how space can aid dialogue and discussion, as well as creating elements of this that could be then easily translated within a care home context, with all the health and safety issues that this entails. And so there are several elements of the den practice that are important to note. Language can be a difficult issue to navigate. Both the concepts of art and play can have different, but both present barriers to engagement. If you call an activity art, this can cause self-awareness in some, and for others the idea of play into adulthood can have resistance. And so I think this practice acknowledges both areas of installation art and playful den making, but sits solely within neither, again allowing creative exploration with reduced barriers. As dens are found in many cultures and places around the world, there is a greater chance of a common understanding with a greater amount of people. And this form of creative engagement allows for playful engagement. There can be some negatives in that there could be, again, resistance to play, as I've touched on with language. And there also is some issues around documentation. It can be quite difficult to document a 3D sculptural space. My den making practice is currently looking at incorporating 4 main elements of exploration. Looking at how the space is created, how the space is engaged with, what forms of narrative occur or are formed, what activities the den space may promote or be created for. This can also help to facilitate a natural close to the encounter, and there also may be a selection of an identity for the den created. Through interviews, questionnaires, and the artwork itself, I will explore these research questions. The research is now waiting for a more appropriate time, whenever that may be, to continue. I'm also designing approaches to infection control, suitable fabrics and props, as well as reducing contact within the practice to minimise the spread of contagions. Thank you very much, and I will now pass you back to myself.